At Whittier, we treat the whole person while considering the practical day-to-day realities of our patients' lives. Think about this. It's hard to shop for fruits and vegetables if you work 2 shifts per day. It's hard to send your kids outside to play if their environment is unsafe. It's hard to remember to take insulin if you have post-traumatic stress disorder from chronic exposure to violence. About 91% of our patients live in poverty, and the life expectancy in our service area is 30 years less than that in the Back Bay. The health disparities we address have complex causes and require a broad approach based on whole-person health.
Working at a community health center, I really have to advocate for my patients. I have a lot of patients that come with, for example, mildly elevated blood pressure, but they don't have housing and they can't pay for food every week. So their least of their worries is taking a medication for something that doesn't cause them any symptoms. So for those patients, I walk these patients down to Men's Health Clinic where there are case coordinators to help them secure housing, food, or other resources. I've had many people who were brought to the point of tears just because we were able to give them a referral to a food pantry here. I understand that working at a community health center, even taking half a day off from work can be a lot for patients. There is a service here at Dana-Farber that allows them to have teleconference visits, which is amazing. It's a service that I would not expect a community health center to have.
Central to our success is the teamwork of Whittier's healthcare providers and other professionals. By integrating medical, behavioral, and non-clinical services, we are addressing the social determinants of health, such as economic stability and education. The individuals and families who count on Whittier appreciate your support every day. 4 of them, Eli, Carol, Nettie, and Kenneth, were eager to share their stories. Thank you for helping Whittier to bring whole-person health care to them and 30,000 others. In Whittier's service areas, 25% of residents lack a high school diploma or GED, double the rate citywide. Unemployment ranges from 13.5% in Roxbury to 17.7% in North Dorchester. Whittier Street Health Center is bridging the gap between health and economic stability.
I believe I am the man I am today with the help of Whittier. Personally, I come from a large family of 7. I have 4 other siblings. I'm the second person out of them to graduate high school. We didn't have too much growing up. I grew up in a pretty bad neighborhood. Definitely a lot of violence and poverty and crime happening in the area. I first came to Whittier Street as a patient. Back then, I was struggling with my weight and a little bit of depression. My doctor recommended that I try out the Race Around Roxbury program, which is Whittier's nutrition and fitness program for overweight children.
Eli has seized every opportunity Whittier offers at risk youth.
Whittier's enrichment program for leadership development taught me real life skills about finance, how to write a resume, even about staying healthy and the dangers about substance abuse.
Eli has turned into a really reliable worker, and people go to him for different questions about the gym, about fitness. He is really good at motivating members of the gym as well to keep them working out and becoming a healthy lifestyle like he has.
I now work in the fitness center front desk, having a job. I'm now able to help my mother pay rent, and I'm excited for what comes next.
Obesity is linked to nearly 30 preventable diseases, including type 2 diabetes, certain cancers, and cardiovascular disease. In Boston, Blacks and Hispanics have disproportionate rates of both overweight and obesity. People in racially segregated neighborhoods have fewer options for healthy food markets and safe recreational spaces, according to the Boston Public Health Commission. Our prescription for health is our philosophy for combining medical care and quality wellness programs. These help our patients change unhealthy behaviors and make healthy life choices to prevent illness and foster good health. It is just one of many Whittier interventions for tackling high rates of obesity, and we are seeing results. Whittier cares for a significant number of patients with diabetes, and nearly 1 in 6 had a blood sugar level in the severely elevated range, at risk for heart attack, stroke, blindness, and kidney failure. According to one study, diabetes afflicts 15% of people without a high school education, compared to 7% for college graduates. Nationwide, Approximately 12% of both Hispanics and non-Hispanic blacks have the disease.
My levels, my blood pressure and my diabetes was off the charts with the numbers. And I got into a program with one of the pharmacy specialists. He changed my medicine. He's really made me realize how important it is to keep my blood pressure and my sugars intact.
Traditional diabetes treatment requires patients to draw blood, monitor their sugar levels, and inject insulin at the same time each day. That's a tall order for many people, especially those with socioeconomic stressors. Now, 6 months after treatment, Nettie's blood sugar is under control.
Whittier has changed my life by making me know that there's a place that I can come to when I'm stressed or when I need help or I need to talk to someone. And I don't know where I would be or what I would do without Whittier Street.
A staggering 80% of Whittier's patients have psychosocial issues, including depression and anxiety. Low-income people and racial minorities are more likely to face certain stressors, such as chronic stress, economic difficulties, hunger, family responsibilities, and discrimination that can harm their health. Many of the individuals we see have undiagnosed trauma due to chronic and long-term exposure to violence.
Every Friday afternoon, me and a small group of women get together in Whittier's community meeting room for our sewing group. We make pillows and quilts. None of us knew each other before we came to the health center, but we just clicked.
This sewing group is one of the several group treatments our behavioral health team offers to build community and decrease patient isolation.
I've come to this center because I was diagnosed about 5 years ago with an illness, and this center has helped me in a lot of ways. I take the nutrition class, the dance class. I use the exercise room quite a bit, which keeps me, keeps my cholesterol down and my weight down. Thank God for this center. It's given us a lot of things to look forward to. Whittier Street has kept me alive.
Whittier collaborates with houses of correction, law enforcement agencies, faith-based organizations, and other community partners to help former inmates re-enter society successfully. Kenneth came to Whittier through the men's support group of our post-prison release program, which supports his physical and mental health, as well as substance abuse problems.
We really care about our patients here at Whittier Street. And here in the behavioral health department, we look at the whole person. We try to provide total care with their mental, physical, and emotional well-being.
I started abusing alcohol and cocaine in my youth. I had a life of ups and downs, and I earned my LADAC from UMass College, which is a licensed alcohol addiction counselor. I also spent time incarcerated. When I got out, I enjoyed 5 and then 10 years of sobriety. But in 2015, I started using drugs again. I was never ever happy doing drugs, never, but I was hooked. Each time I met one-on-one with my counselor, Carolyn Reynolds, which is a therapy/recovery coach.
Kenneth is doing great. At Whittier Street, we connect individuals with health care, individual and group counseling, job placement, skills development, and job training. The future is looking very bright for Kenneth.
By aligning social needs and health programs, we are building a legacy of health and a stronger future for the communities we serve. Whittier's mission is to improve wellness in its patient population by addressing the underlying issues causing health disparities and the social determinants of health. This vision can be fully realized with our approach of innovative and integrated service delivery, education and prevention strategies that result in community empowerment, health equity, and positive lifestyles. We believe that with a consistent focus on culturally appropriate, cost-effective, timely, and high-quality care, we will attain our goal of health equity in Boston.